We're healBetween. We're here to help clients to stay engaged between therapy sessions. This is Charlie, here together with Harry and Brendan. As a clinical psychologist trainee, we observe that the main problem with psychotherapy is that 1/5 of patients drop out of therapy in Asia. We found out that the main reason is that client engagement happens between sessions. In private practice, this leads to an average of 20K loss. In Hong Kong, this issue is much worse. When you look at the length of the time between sessions, the gaps can be as long as a year in public sector. In therapy, growth and change actually happen between sessions, and just like medical doctors prescribe medication, therapists prescribe in between sessions assignments. This means keeping client engagement is essential, not only for preventing dropout, but to make sure they have a good therapeutic outcome.
So our first system focuses on keeping clients and therapists stay engaged between sections. We allow therapists to create personal tasks so that the homework could be more personalized and more engaged with the clients. We set up a gamified progress and reminders so that we keep clients motivated. We also set up a clear communication channel with clear boundaries, so therapists could clear up clients' question between sections. Another huge issue we find after interfering with too many therapists is that they are trapped in a really inefficient system. They wish and need to track patient progress. They really wish to pay full attention toward patients. And they need to assess patients' profile through a quick and organized way. But right now, there are no system or no any way to do so. That's why we also laid out first part as assessment tracking, where we wish to empower therapists to focus on practicing through a system that they could set up and track pre-session assessment, like tests before clients arrive, so that in the macro level, they could see how clients perform, as well as the client between section assignments, so that we could easily track how well our clients sticking up to their homework. We also have some sections automation tools where, for example, section notes are automatically written down and organized in a clear and an organized manner. We also managed to put and lay out the whole client's profile for a really organized way, which are often really complex with personal info, past history, lots of medical details, treatment plan sections, and different test goals.
So when looking into the market, existing platforms only focus on either workflow automation or engagement tools. healBetween is the only one with both automation and engagement tools, creating a strong positive reinforcing mechanism. Most of them also only based on Western regions and cultures. So we are the only one being culturally sensitive with multiple languages, supporting local Hong Kong users. Yeah. Our business model is a B2B subscription-based model. Firstly, we will target private practice therapists at 1,500 per month. And secondly, we will target organizations on a bulk model at 1,200 per therapist per month, partnering with NGOs, hospitals, and universities. And for the market, the Hong Kong serviceable market is about 15 millions and keep on growing itself, while the total addressable market is massive across APAC with over 10 billion. Our team put a strong emphasis on relationships and engagements. So we aim to co-create with real users that are the therapists in a fast iterations so that we can proactively find early adopters in Hong Kong, such as private practice and NGO therapists in NGOs. And we aim to aggressively expand in the next phase and then rapidly scale across Asia in the next year.